So we've taken a tour of the hospital, and as we've seen, it's they have very limited supplies, very limited equipment. We've talked a bit about dentistry, and what we've been told is that they don't have all the proper equipment for doing drilling and filling. The FBR and the Partners Organization both can provide training, so they can train dental medics, but if they don't have the proper equipment, then they won't be able to treat the patients, even if they have the training. In the men's dormitory, or rather the men's patient area, we have 2 men that are affected by HIV. What we've been told is that there's absolutely no medicine here at all, no antiviral medications for the HIV patients.
Her name is Passerge, and she's from Shan State. She's been here since 1999. When she first moved here, there was no clinic. There was a home. Just after 2003, they moved it right back up here because the women who were giving birth had such a difficult time getting down to the hospital and injured people.
What's that?
She has a tumor. They can't operate on it when it's hard like that. It has to soften or develop differently before they can operate.
And where would the operation be done then?
They do it here.
Really? And what do you mean, soften naturally, or do they put a medicine on it, or?
She's already started her on a regimen of medicine that's supposed to soften the tissue.
Wow.
Those 2 guys in the inpatient that we just saw in the inpatient ward, they have AIDS, and this lady here has AIDS. And they don't have living family, they don't have a place to live, and they don't have any home to go home to. So Paul Sergei is trying to find people to support her, to build them some place to live, and find some kind of sustainable way for them to provide for themselves.
And what about medicines, antivirals?
Paul Sergei says that all they can really give is antibiotics that they take every day for the rest of their lives. So they're really just treating the symptoms that may arise from the virus.
So is that a donation that we need to find somewhere then? We need to find like antiviral drugs? Or the AIDS treatment?
There's no way they can afford to buy antiviral medicine for AIDS. So they use fluconazole, and that's an antiviral.
And a patient taking that medicine will have a very short lifespan, is that correct?
Fluconazole?
They're not really going to do
anything.
They're going to do anything. So,
like with HIV, like it's about the immune count. So if the immune count is really low, then they get an infection. So you give them treatment for the infection, and maybe you might prolong like their treatment, their condition for 1 month, 2 months, 3 months. But if the immune system is already low and is decreasing rapidly, then it doesn't matter how much treatment you give for the infection, because the immune system is the problem. So it depends on how long they've had the disease for, and the longer you've had the disease, then the lower the immune CD.
And then living in these kind of conditions, I would assume your immune system is weaker. And
well, when you've got the virus, then your immune system generally over like 8 or 10 years, this CD4 count goes down and decreases over time, like just with the disease. So the question in how long they're going to survive isn't really whether you have to consider how long they've had the disease. So if their immune system is already low, they're already going to get lots of different diseases. Yeah, absolutely. So if their immune system is still good, but they have a cold, well, it's very good to treat the cold at that time, or to treat the viral infection, because their immune system just needs a little bit of a kick boost to help survive against that disease. But if they've had the HIV virus for 7 years or something, then already their immune system is going to be a lot lower, and so even when you give the medication, it's really only going to have a very limited effect, because the underlying cause is how good their immune system is.
Right, essentially treating the symptom, but not not dealing with the disease.
So if they're earlier in the disease, then it's better to treat the symptom.
Sure.
Because they're going to have a greater effect from that treatment. But if they've had the disease a long time, you can treat like TB or something, but it's not going to last. Not going to be as effective.
Like no real staff.
ยาก็ไม่พอ
no medicine.
สตาฟก็มีแค่4 คน
There were 4 sort of medics that were trying to help people.
แล้วก็เทรนเพิ่มอีกปีละครั้ง
And each year they also gave some invested in training medical people at
แล้ว
Dr.
ก็เครื่องไม้เครื่องมือ
In the beginning, she didn't have any support for medicines or equipment, and so she relied on smaller organizations like partners to pay for her medicine and hardware that she needed to do what she was doing.
แล้วก็แบบ
At that time, they couldn't pay for the medics, couldn't give them any money to live on, and FBR and partners were the ones that supported her to get started.
แล้วก็หลังจากปี 2000 แล้วก็ย้ายลงไปข้างล่างเพราะมันใกล้น้ำมาก
Since 2003, they moved to this place because it's closer to water.
I'm Antonio Garceffo. We're in the IDP camp at the SSA headquarters at Tailang. This is Baman, and she is 43 years old. Been here for 5 years.
Yeah.
And why did she come here?
เป็นจังเลยมาอยู่กันเลยฮะ In Shan State, the SPDG brutal and they forced to move and they can't live. They have no food in Shan State. Why did they come
They
in?
they forced the family to move.
Yeah.
And what about her husband? Is he here?
Oh, now her husband in hospital clinic.
In the hospital.
Yeah, it's not well.
What happened to him?
มันเปลี่ยนทางค่ะ Oh, the landmine touched his hand.
He touched
Yeah,
hurt his
landmine.
hand with the landmine.
Yeah.
How did that happen? Where, in the village or here or where?
ก็เลยค่ะต้องนอกต้องตักมันเนาะoutside the front line.
Outside the front line.
Yeah.
Was he a soldier?
ตัวเป็นชื่อกันเนาะ Yeah, sure.
Oh, he's an SSA soldier. Were they fighting?
ต้อง Oh, yes, step by landmine, not fight.
I'm sorry?
Not fighting, just step to something.
On
Yeah.
the landmine.
Yeah.
All right. So Baman's husband right now is in the hospital. He was an SSA soldier, and he was injured with a landmine out at the front line. Apparently, he's got a hand injury. How many children does she have?
Have 5 and live with them 2 or 3 and not live with them 2.
And where are the two?
แต่สองกองนี่แหละครับนะ Oh, they go to work, but they don't know.
Go to work where?
Yeah.
In Thailand or in Shan
Yeah,
State?
they don't know.
Don't know.
Yeah.
Just go. And the children, they live with her. How old are they?
And 12 years and
6 years.
6 years. Yeah.
Oh, okay. Small children.
Still in school. Yeah.
Oh, still in school. And what is she doing right now?
อันป้าเขาอย่างมือเดียวหน่อย Oh, to make money.
To make money.
Yeah.
What is this for? Is that the roof for the house?
Yeah, for the roof.
Oh, and she sells them.
Yeah.
So this is a family business.
Yeah, business.
How do they get food? Yeah. The organization gives them some rice and things
Some
every month,
short, yeah.
Do they have a family farm? Or are they family garden?
สองป้ามีสวนพักสวน In rainy season they have farm they grow vegetable crop, but in the hot season summer they just raise chicken and pig and other animals.
How is their life here? Is their life better than inside Shan State?
ป้าอยู่กันในเมืองจันทร์ในกาลาลีเดียว Here is safety and have enough food.
What about the school? Did they have a school in their village?
Yes, but yes, we have only SPDG primary school. But if no money, we cannot attend.
So her children are getting better education here at Tailang. Thank you very much. I'm Antonio Garceffo from inside of Burma, and please say a prayer for the people of Shan State.